Story 48. Patient. Self-diagnosed a gallstone stuck in the tube after having my gallbladder infected and removed. Could not keep food down, had excruciating pain in the same spot as my gallbladder, and went to the hospital on 3 separate occasions and was told nothing was wrong. Was kept for a week after being taken to the ER for extreme pain in the same place as where my gallbladder was. Did tons of tests, including endoscopy with no results, but couldn't even eat a spoonful of food without doubling over in pain. I was on IV for a week before I suggested to a doctor that I eat something, and then they do a CT scan when I was actually in pain versus doing all the testing when I wasn't eating, and the doctor said, sure, why not? Finally, they saw not only a stone, but sludge and sediment. Had another endoscopy to clear it all out, and was eating by the next day at lunchtime. I cried the first time I had eaten food without being in pain. ETA. Not one but 2 doctors suggested I take Tums and or Pepsid, and that would make it go away. They also were suspecting I was there for pain meds and making up this pain, even though I had just had a C-section a month and a half prior and had a breastfeeding baby at home. Very frustrating and disheartening to say the least. Story 49. Biggest thing I can say from a provider standpoint is that the increasing work demand, with less time to do it, with increased accessibility to patients sending in mobile messages via the portal, etc., makes it more difficult to get accurate diagnoses. I frequently have patients writing in that want to change treatment or have labs drawn, etc., and I just want them to come in for an appointment first. It's amazing how often they are convinced it is one medicine causing a side effect, when another one they are on is known to cause the issue, or how the labs they wanted wouldn't actually help diagnose what they are looking for. I believe in patient intuition, and although I genuinely can't think of a good example of someone diagnosing themselves, I do like to ask what they think is going on, or what their goal is, because otherwise we can end up on 2 wildly different paths. Sometimes I do find that the same patient coming back and explaining the same symptoms another day will lead me to a totally different conclusion. Maybe that is because our first try didn't work. Maybe they just said the right thing that time, or maybe my plate wasn't overflowing that day. Either way, I am never upset when a specialist finds something I missed, etc. I am just happy a patient gets answers. Story 50. Not a doctor, but a rural paramedic here. Several years ago, had a woman call with feelings of impending doom. No pain, no symptoms, just, I feel like I'm about to die. Vital signs all normal, on scene exams all normal.